Good afternoon, everybody. I apologize, I had a little technical difficulty, but I'm here. So for the record, let's go around and everyone state your name for the record as part of the roll call process. Just go around, everybody do it. My name, I'm Elliot Palmer, and chairperson of Substance Use Advisory Commission.
I'm Ryan Johnston. I'm the vice chair of the Substance Use Advisory Commission and the lone member of the Communications Committee right now.
Hi, I'm Susan Foster. I work at the Post Center for Health Education. I am chair of the Education Committee. Might be one of the only ones. So.
Hi, everybody. I'm Nick Slovak. I'm a member of the Outreach Committee.
Hi, I'm Kemi Amola.
Hi, good afternoon, everyone. I'm Ara Torres, and I am the staff liaison for this commission.
Okay. All
Good
right.
afternoon, everyone. My name is Dr. Artina Hamilton. I am the Director of Equity Inclusion. We're happy to join you.
All right. And was that everybody? Yeah, so far for part of the commission. And I see we have a couple of guests. Welcome to you all too. We'll get that in just a second. So before we get started quickly, we have a motion. Everybody got a copy of the agenda for today. And we have a short motion to accept the agenda.
Motion to accept.
Okay. All in favor? Show of hands. Okay. All right. And the minutes from the last meeting.
Motion to accept.
Okay. Show of hands. All in favor? Let the record reflect both were accepted unanimously. All right. Okay, so we have some guests on today, and I'm glad to see them. It's good to see you all since the last week. But if you all wouldn't mind, Samantha and Sarah, introducing yourselves and letting the rest of the commission know who you are, what you do.
Hi, I'm Samantha Weintraub. I've joined a couple of these meetings in the past. Sarah Ainsley and I are on we're all city staff from different departments, and we're on a strategic initiative committee dealing with opioid use and trying to do similar work to what you all are doing. So we are making an effort to join these meetings regularly and connect with you all. So Sarah and Ainsley, I don't know if you want to say anything.
Hi, good afternoon, everyone. Sorry, it's traveling. It's on my phone. Now I'm on the computer safely. My name is Ainsley Worrell. I work within the Recreation Department, and I co-chair our strategic management group with Sarah. So happy to be here.
And I'm Sarah Heinzen. I work in emergency management and special events. Like Ainsley said, I'm a co-chair of our initiative, and we're just happy to be here and connect with you all. We met with Elliot recently, and we just like to continue the conversation to see what you're working on.
Okay, great. Thank you, all three of you. Ainsley, I'm sorry I didn't see your picture when I was first saying introduce yourself, but welcome and good to see you. Dr. Artina or Dr. Hamilton, would you like to say something?
Hi, everyone. Again, I'm Dr. Artina Hamilton. I am the new Director of Equity and Inclusion for the City of Raleigh. I'm really excited to be joining you today and look forward to working with you in the future. I will say I have to leave a little early to attend another meeting, but happy to be here.
Okay, great. Well, welcome. Is anyone I miss? Anybody I miss our
No, Jeremy is on the line as well, but he is as an attendee. So just to let you know that he is, which he's part of the team working with Inslee and Sarah and Samantha as well. So he's attending just as a viewer on the other end.
Okay, and Jeremy is a member of the Raleigh Police Department. Okay, all right, great. Welcome, Jeremy. So everyone, give me a little update. Chairperson's report since our last meeting. I met with Sarah, Samantha, Ainsley, and Jeremy, along with another young lady, Wendy and B. I didn't get Wendy's last name. She's also a member of Raleigh Police Department. But we met just to see. They want to know a little bit about what the commission is doing, and we were brainstorming on how the commission could collaborate with them and the other organizations that they represent to help, promote our efforts here in Raleigh. Some of the things we talked about, maybe attending or might be helpful for us to get in touch with, doing more stuff on social media to help raise awareness among city employees, also attending county coalition meetings. Even though that we're the city of Raleigh, but the city of Raleigh is part of the county. And using these, doing a resource collaboration and updating the resources on, I think when we were talking, they were interested in, the resource list that the Substance Use Advisory Commission was gathering. But having that list posted somewhere publicly, or if they could share somewhere we could share our resources and share that list with them. Did one of you all want to say anything to the rest of the commission? Something, that's some of the stuff we talked about. I don't know if I've gotten it out correctly.
So I'll hop in. Elliot, yeah, I think you covered the essence of the conversation. We wanted to connect with this group to learn a little bit more about what your focus, your goals and objectives were, as we took really a course of a year to try to put some text to a work plan to sort of help to inform our work. On behalf of Samantha and Sarah, who's represented here, we had a lot of learning to do. And so that's how we stepped into this space and connecting with the Wade County Commission, and also had a meeting with Alliance Health, which I think has really helped to form our perspective a little bit. We're in the process of actually scheduling a meeting with the Apex group. As we know that Apex has a group, I think it's a task force that is being supported by their mayor to focus on prevention and education in the Apex community as well. So in essence, we're continuing our education, but we wanted to be connected with this group. So one, that we could have conversations, but then also if there are opportunities for us to collaborate moving forward, not just on the public end, but then also from an organization perspective. Maybe there'll be an opportunity for us to collectively develop some strategies specifically to help the organization continue the effort and moving forward. So I don't know if Sarah or Samantha have anything else that they want to add, but that covers it for me.
Thank you.
And I have a quick question. What is your organization? What is your group called?
So we are under the Safe and Vibrant Communities on the strategic plan for the city of Raleigh. And our group is focused on substance use and prevention. Our charge is to find ways to support, to represent the city in essence with other organizations in the community that's providing either prevention efforts, doing education and outreach, and connecting families with those resources that they need. So that's strictly from the text that's in the strategic plan. And so our charge is to try to figure out how do we best step into that space, if that answers your question. Sarah, you want to add anything to that?
No, I was just going to say, we appreciate you letting us be here. We're still trying to educate ourselves. And we just want to make sure we're not duplicating any efforts that you all already have going on. We don't want to change your plans. We just want to learn more about what you're doing so we can know, how best we can assist the city and our community.
Thank you.
All right, anybody else? Do you all have any questions of them? Okay.
Yeah, I would love, like, so can you maybe just talk a little bit about what your goals are for the future? Or like you said that you guys are working on a work plan, like what are like maybe specifically what some of the work that you guys have been doing?
Oh, well, I'm muted. So our group really formally got together about a year ago. And I'm pretty sure all but one person who's no longer with the group, we're all new. We were all sort of recruited in a way onto this initiative. So we were all new to this work. And so over the course of the last year, what we've been really doing is some research on our end. We started just some conversations with some external groups, as I referenced, Alliance Behavioral Health, in a way to try to understand what their focus has been in the community. And through Alliance, we were able to get connected with the commission, with the Wake County group. And I believe we've attended 2 meetings to my knowledge. So in essence, we've kind of been on a fact-finding mission to kind of understand where is the county with the work that they're currently doing, but then also how does the city through the commission connect with that. We were fortunate enough to get connected with Araceli and Elliott. So we met with them. And so most of what we've been doing on paper is getting ourselves acquainted. But when we started to put pen to paper regarding what our focus ought to be, we started to look at, is there opportunity for us to support community organizations and then also the commission in the education effort, any sort of collaboration that's already occurring as well. But we've had some conversations on our side in essence, okay, are there opportunities for us to also look at what other groups are doing beyond the city of Raleigh? Like for instance, having a meeting with the Apex group and then looking at other organizations that are similar size to figure out how are they supporting substance use prevention efforts. So are they, for example, putting resource towards having a full-time person to support a task force like you all have? Are they looking at other opportunities to collaborate with community agencies and advocacy groups to have a presence in the community? I know, for example, in San Francisco, there are some sites that are supported by officials to be sort of resilience resources for folks. So folks who might be homeless or are dealing with substance use will get routed through those sites so that they can be connected to resources. So those are some of the conversations that we've been having.
Awesome, thank you. And it's pretty cool that you guys are working on that.
And hi, Ansley. I think we've met in the past. I work again at the Post Center. So it's great to see you again, and I can think of some things coming up that I'd like to be able to, some I'm going to bring up at the meeting here, and then maybe we can get a chance to share and just kind of also continue that collaboration through the Post Center, as well as, you know, it's an arm of what happens here as well. So good to see you.
All right. Well, great, everyone. So at this point, I'm going to move on so we can get the rest of our stuff going. If at any point, one of you all visitors or member of the commission have a question they just thought about, or some comment they want to make, feel free to just raise your hand or whatnot and jump in. So could I get the staff liaison report?
So I am reporting that starting April, we will be meeting in person. That's gonna be, for you all. We are looking right now as far as location to meet. So plan A that we do have is to be able to move your meeting to Pathway Center. That way you won't have issue with parking, because we have parking and we have a pretty ample conference room because this group is smaller. Right now, the directive we were giving is in person, requesting for staff and commission members to wear masks. They haven't given us other direction other than that so far. So that's what I have. I'll keep the commission updated as far as sending you an address for location or any changes or anything that can come up. I will definitely send that to you.
So Ara, was there some issue with having the meetings at City Hall as we've been doing?
So one of the things that we found is with all boards and commissions going back in person, we're having some subcommission, some other boards and commission having meetings at the same time. So we're trying to figure that out. We were looking at accessibility as far as finding parking, making it more accessible. And we have a facility that's, you know, we do have a conference room that is pretty ample. So do you have a preference with keeping the meeting at the municipal building, Elliot?
Yeah, I mean, that's just what I'm used to. Other than Susan, I don't know if any of the others have had that privilege or that experience.
Yeah, I went to City Hall. Are you talking about the building
Yeah.
off Martin Luther King?
Yeah, right. Yeah, I think you
Yeah.
were there for a couple of meetings before everything got shut down.
Yeah, so Pathway Center is at Martin Luther King.
Yeah.
So it is a separate building, and we have parking with
No, I was the
municipal
Pathway
building, I
Center
think
is
it's
where
a
we had our retreats and whatnot. I was talking about our regular meeting. Ryan is usually held down at
Yeah,
City Hall.
I've been to that as well. I mean, I personally think the Pathway Center is easier, is more accessible because you don't have to park in the parking deck and get it, get your parking taken care of and all of that. But so I would be happy with Pathway Center versus City Hall, but that's my personal preference.
Yeah, I'm fine with the move to your site, Maria. So thanks for working that out for us.
Yeah, we're working, trying to get all our boards and commissions. It just makes it easier, and we don't have to be fighting for room with others. So it's just with different people having, having to move, it is kind of becoming a little struggle. So we figure the easiest thing for us to do is try to push for all our boards and commissions to be at our site, since we will have the capacity. We have security guard during that time, so they'll be able to open doors and whatnot for the guests coming in, and you'll just have to sign in. So we'll be in the conference room upstairs. That is the plan. That is plan A that we've been working with our assistant city manager. So I'll keep you posted. I will keep you posted on that. And that's all I have.
All right. Okay. Well, thank you. On that, I'm going to move on to the commissions, to the committees. Also, I'm sorry, I'm a chairperson's report. keep in mind, we do have a vacancy on the commission. I don't know if did I get a chance to tell you all last time that Holly has stepped down from her seat on the commission. She has some other work and other obligations that are requiring her time. So we do have another vacancy on the commission. And I encourage, let's see, well, Dr. Kimmy, I think you're the only one. Our new commission members to feel free to join some of these committees. All right, so the first, and if you know something you're interested in today, you can let us know while we're going through our committee reports. So the first committee report, if we could hear from the medicine drop-off subcommittee.
So still no report from, we take our lead, of course, from law enforcement. Since they're required, we have to have them to do these. And as I said in the last meeting, I sent off an email saying, hey, please let us know as soon as you get a date or if you're looking to do this. And as of yet, there has not been a reach out to us about that. So usually it is in April. The national take back is, I think, around April I want to say the 28th, which is a Thursday, but I know we tend to do ours on the weekend. So I'm still crossing my fingers. Hopefully it'll give us enough time to really do some good planning. So if not, we might have to plan through reaching out in emails since it might not be enough before meetings, but I'm sorry, haven't heard anything yet.
Okay, thank you. And Susan, I guess you're up again, Education Committee.
Yes. So last night, I'm putting in the chat box a flyer that I'd love. I sent out an email, and thank you, Aria, for getting that pushed out through the city about our hashtag youth culture spring community education series that we're doing online. We had, usually we get about 20-ish folks on those when we've done them in the past. So, and last night we did have, for our first rollout, we did have about 7 of those there for the adolescent brain development and addiction. A good crowd, very interested, if not small. And tonight we're offering the Spanish version of the adolescent brain development and addiction. So the flyer, if you can pass that out, it's there for you. And especially our guests that are here today, if you hadn't had a chance to see that. We are offering board certified hours for folks that need those, as well as an opportunity for those trainings that have been supported by the commission. So, so there's that. Also, I'd like to share, if I can, a document. I'll try to make sure it has all where you can get to it. Sometimes it gets blocked. So I'm going to work on that and send it later in the meeting. But we are looking for, the Post Center is looking for volunteers that can help us with tobacco prevention efforts. So we're doing purchase surveys, and that is where we are looking for, the law's been changed to 21 to buy tobacco products. And we need 21-year-olds, 21 to 25-year-olds that look young, that we will age test to make sure they look that age, and that we would take out and they would try to purchase tobacco products. And what we're looking for is that they actually check for ID. And then we make note of that. We collect data. We if they fail, if the merchant fails, then we go back and say that we'd like to help them, educate them, so we can reduce youth access to tobacco. And we also do this with alcohol as well, but our focus now is on tobacco. So I want to put in some information. Y'all can just cut and paste in emails and send out to any youth that, young adults that we used to get 18-year-olds, but now we got to find 21-year-olds, and they're not as easy to find, that would fit this bill. So we are having a training next Tuesday, but if they can't make it to that, we will find a way to train them. We are paying them. So so really would really appreciate the help on that. I know that's not quite education, but it certainly meets our needs here. And we absolutely have to do these surveys. So, and all the data shows that, there's a weak link with our merchants and so forth. So any questions about that? Or as I said, I'll put the information in the chat once I make sure I've taken off all the security elements. So it sends easy.
All right, is that something that we can put through our website?
I would have to find out as far as, I don't know that they will allow it. Just so they will usually allow anything that's a direct partnership or anything specifically. So I don't know if that would be considered a direct partnership with the commission, supporting it as they do with the previous program that we release information out on the flyer and all that. So I would have to find out just the details on that, but I can follow up with that. I'll get back to both you and Susan.
Okay.
I did want to mention regarding Susan's comment is for members or even for our guests for today, if you want to get information when we send out anything via Gov Delivery or just information, if you want to register, if you haven't with substance use, add that one as one of your selected areas in Gov Delivery so that you get the messages that we send out directly, just like the flyer that we did. So anybody is welcome to join in and fill out the form and say you want to join substance use, the commission, and you will get the information we sent out.
And it's fine if it doesn't get pressed out like this. It's a little, it's okay if merchants know we're going to do this. Sometimes that can be helps us reduce their chances of failing, but it's okay if it's a little on the down low. And I'm okay if it doesn't work out, but I appreciate people and we don't need a fleet of 21-year-olds. Certainly just we're going to do it for the next couple of months and we have to work with schedules. And so it's nice to have a pool to choose from, but I'm putting it in there for you. So that's just some of the basic information. And then they've got someone can volunteer, but then if they fail the age test, we cannot use them. So that there's a little bit of finding very specific people that are good for this work. But so other than that, that is our main push to get the SUAC supported education sessions out. And again, we're hoping to hear something about the medicine take back. So that's where we are.
And on that medicine take back, I see where Officer Pearson, Jeremy Pearson, mentions he'll try to figure out who's in charge of the drop off stuff and see if he can reach out to them. And I don't know if you're able to look at the chat also, Jeremy, but I put in there where Detective Bruce Bilzup has been our contact. He's been the lead person on the medicine drop off for the last few years, and just us having issues trying to stay in touch with him or contact him.
Yeah, no, he responded pretty quickly saying they just haven't gotten a date yet. But yeah, he's our fearless contact. And I just think they haven't quite pulled it together. And I hope there's a couple things we want to make sure the flyer is updated that last time we used it. So I hope it's sooner rather than later if they're planning to do it, which I hope they do, because we're a little behind from the pandemic offering these, but I'll definitely let y'all know, especially if it's in between a meeting like this.
Okay. All right. Outreach subcommittee. Anyone?
Yeah. Hi, everybody. So we've been working, Sean and I have been working on a resource list. I actually just shared it with all the commission members to your email. If between now and our next meeting, if you guys could take a look at that Google Doc and add whatever resources you think might be applicable, North Carolina or in the city. I put a bunch of stuff on there, actually low cost options. And what we're trying to get is at least the name of the organization, a phone number and an address. If you have an email address, that's awesome as well. So please take a look at that document. Sean and I have been traveling, so Sean and I have been working over email a little bit. And he actually also has a folder with some other documents. He owns it, so I'm unable to share it, but I'll ask him to share it with everybody. But we've been kind of making some decent progress on that project. Hey, also, Ainsley and Sarah, if you guys wouldn't mind throwing your contact information in the chat, I would be happy to share that with you as well, and give you guys some info on that project that we're working on.
All right. Also, I guess it's some subject of outreach. I don't know if you all have had a chance, we voted as a commission to sponsor registrations for members of the commission that want to attend the Alcohol and Drug Council of North Carolina, their conference, which is taking place tomorrow and Friday in Wilmington or Riceville Beach. And I don't know if you all had a chance to get with Lynn and get your registrations or find out if they're alternate virtual or whatnot. But it starts tomorrow, and if you can contact Lynn if you're interested, or if you haven't already contacted Lynn, let her know. And this is something we've already spent money on, so you're welcome to come.
I sent Lynn an email on Monday if they had gotten any virtual capabilities set up, and I have not heard back from her, just so you know. So I'll send her another message tonight, because I can attend virtually some of it, but I can't be there in person. But I think Sean said that he was going. So that's great. Are there any, and then Lynn, of course, will be there. Are there any other members that will be there?
I would be interested in the virtual option as well, Ryan, but I can't be there in person, but so I guess if you hear anything, if it, I don't know I'm sure you'll send it out to everybody, but that would be great.
I'll email her right now again.
Because I'm interested in the virtual as well.
Okay.
And I'm going to try very hard to be there on Friday. I don't know if I'm going to be able to, but I let her know that.
Elliot, if you're talking, you were muted.
You're muted, yeah.
I'm sorry, you all. I was talking to Lynn. Lynn, we're having a meeting, and we were wondering if there were any online options for the commission members to attend the conference.
No, there aren't. I'm sorry. No, there aren't.
So there are no online options. Okay, I can see you're busy, but we're having a meeting. Just want to check in with you. Anything you need to.
I'm sorry. No, I'm like stretched out right now.
Okay.
I meant to send an email saying that I wouldn't be able to attend. We're right in the middle of setup right now.
Okay, well, let me let you go. I'll see you in a little while.
All right. Thank you.
All right.
Bye-bye.
Okay, so yeah, so there's no online options for the conference. And she's in the middle of setting up, so that's why she's not here. But I will be attending. I'll be, as soon as we hang up, get off our meeting, I'll be headed down there myself. Let's see, anything else? We have openings, conference. Okay, all right, the communication subcommittee. And I believe that might have been Holly and who?
Yeah, it's Holly and just myself now. So really my plea is it's just for one of the new members to consider joining the communications committee. It is primarily what we've done is taken the information from other committees in the commission itself and put that into formats that are appropriate for the city to distribute. And then we try to advocate to allow for more openness and avenues for us to be able to communicate using the approved city website and social media pages. So it is, I would love to have somebody on it. Oh, great. I have somebody, yay. So I'll send you
Okay.
an email and maybe we can go get coffee sometime in the next couple of weeks. So I'll shoot you an email. Okay. Well, that's great. You made my day. Thanks.
Yay.
Ryan,
All
let
right.
me know too. I would be happy to come as well.
Okay, great. Anybody else? Well, that's on the committee reports. Any new business? Anyone want to bring to the table? All right. So I have here on the agenda action items to be approved or voted upon. One will be the approval of current commission member contact information. So who is keeping track of that or putting that together?
What was that again?
We're supposed to be making a list of current commission member contact information.
Yeah. I think actually Ara sent that to us. And I can send it out to everybody else. The only thing that needs to be updated on it is Holly is still listed. So we just need to take her off before we approve the list, I guess.
Okay.
So
Is it anything you need right now, Ara, or is that something we can be doing, communicate through emails?
No, it'd be fine with the emails. Mhm.
All right. Well, I'm so pleased to have our visitors here today. We have a few commission members that weren't able to attend today. Love for you all to come back on and join us each second Wednesday. From next time we'll be in person and the Pathway Center. We'd love to have you all come on and join. Anybody else you know that's interested, come on and join us. And looking forward to the collaborations, see what we can do moving forward. And thank everybody for being here.
Elliot, real quick, can you tell us when the next movie series is?
Okay, so I put them, they had some rescheduling of dates.
Okay.
So I'm waiting for them to contact me to let me know the definite list. And so I'll make a call when we get off to light a little fire under that process. But we should have definite dates, the revised schedule of dates and movies. I would guess by Monday.
Okay, great, thanks.
All right. And we had a good turnout for the last one. I want to say 13, 14 individuals showed up for that movie viewing. But once again, once we do get the dates and the schedule, we need the commission to show up. We come up with these initiatives and we come with activities, and if we want other people to support them, we should support them by example. That's just something to throw out there.
Well, I
But
think
yeah,
it'll be easier to, now that the COVID rates are down and there's a little more comfort of sitting 2 hours in a room with other folks. So I think that might help with that. Certainly would be for me.
Okay. All right, great stuff. With that, I'm trying to see anything else that we need to go over, or just a reminder of. Let me know if there's anything I can help. And if you all want to take a moment to go into the chat, Ainsley, Officer Pearson, Sarah, have all put their contact information in the chat.
Yeah, we have. And yeah, I just want to say thank you for allowing allowing us the space to hop on, meet everyone, hear a little bit more about what you guys are doing. Susan, yes, feel free to connect via email, send me any information that you have. And I just, again, might be obvious, but I just want to be sort of intentional in saying that as you all go forward and you have initiatives, please keep us informed, and we'll do our best to attend. I know I will, as many meetings as I possibly can to support you all, because in essence, I feel like that's what we're being charged to do. So we appreciate the space and the time, and really looking forward to future collaborations with you all.
All right, thank you. Thank you all for being here.
One more thing to kind of shout out that I'll be sending information on is that Wake County is offering a tobacco forum that is youth led by our, and I think Ansley, maybe in the past, we talked about that, that our youth educators within PO are really lead this charge to kind of educate parents and community leaders around this issue. Sid Hutchinson's always attends, and we do a number of things around trying to raise awareness about tobacco and its impact in our community. So once that, it's supposed to be April the 28th is I think we've narrowed it down to then. So there'll be information coming. And again, the goal is that if we could help push it out, it will be online. And so hopefully that is easier for folks. So just want to give a shout out to that.
All right. Well, everybody, thank you all for your time. Thank you for your input. Thank you for your concern. Thank you for your efforts toward helping the citizens of Raleigh. And just appreciate everybody here, and I hope everybody has a great day. Can I have a motion to adjourn?
Motion to adjourn.
Okay, well, all in favor? Yeah. Okay. All right. Well, I'll see you all in person next time in April, and everybody have a great day.